na amin pong pinopropose. Ang una, we would like to amend the Magna Carta for public health workers that it will now cover both public and private healthcare workers all over the country. Ang salient features po ng ating Magna Carta would include the provision of hazard pay to all of our healthcare workers. Kasama rin po dyan yung educational assistance natin sa ating mga healthcare workers, especially yung mga beneficiaries ng ating mga COVID-19 healthcare workers. Another one would be additional compensation. So kapag may Magna Carta kasi, kapag kami pinatupad, usually public health workers lang po base sa batas natin ngayon. But if we amend this to include both public and private, the private sector also will receive the same amount as what the public will receive. Ang pangalawa, meron tayong sinusulong din na batas based from our experience during this pandemic and based from what's happening in our country right now, that there is really this migration of healthcare workers. Nakikita natin yung gaps natin sa ating mga facilities at nakikita rin natin na mas nagkakaroon ng migration kapag internal to our government facilities. So nagsusulong tayo ngayon ng isang bill, yung salary standardization for health human resources for health, both for public and the private sector, both for the national and the local health sector. Para wala ng differentiation kapag naipasa itong batas na to as to the salaries between the public and the private, the national and the local. Whatever a healthcare worker will receive from the public sector, dapat mapapantayan na rin yan ng private sector ayon dito sa pinapatukala natin na bill para sa may pasa sa Kongreso at sa Senado.
Thank you, Yusek. Our next question is from Ms. Dec Villanueva of the Philippine Star. May we get additional details as to the plan to implement a school-based surveillance system in relation to the ongoing face-to-face classes? Who will be in charge of this per school or per campus? And when will the implementation start, Yusek?
Yes, Dec, no? So unang-una, itong school-based surveillance, dati pa naman nangyayari ito. Itong surveillance natin sa mga eskwelahan, spearheaded ito ng ating mga epidemiology and surveillance units in our local governments and of course, assisted by our regional epidemiology and surveillance units. So nung wala pang COVID, nagagawa na natin ito. We had different infectious diseases na atin talagang binabantayan pagdating sa eskwelahan. Lalong-lalo na yung mga madaling kumalat, katulad ng measles, katulad ng flu, influenza, and kasama rin dyan yung dengue at iba pang sakit. So ngayon na may COVID-19 at nagbukas tayo ng ating mga eskwelahan, atin pong nire-reiterate that we strengthen the school-based surveillance system. We had already our initial discussions with the Department of Education kung saan DepEd, of course, will head this together with our local government units. Kaya napaka-importante yung partnership natin ng DepEd, ng ating local governments at saka ng ating Department of Health para maiayos natin ito. We have this initiative among the different schools in the country, yung healthy schools. Kasama sa healthy schools initiative natin yung surveillance system that will be able to track, to monitor different diseases among the students and will be able to prevent them. So napaka-importante nitong surveillance system na to. Ito may mga safety officers tayo na tinalaga sa DepEd sa mga bawat eskwelahan para sila mismo ang nakikipag-coordinate sa ating local government officials or healthcare workers for us to be able to implement the surveillance in our schools.
Thank you, Yusek. For our next question, mula po kay John Garner ng Daily Tribune. Budget Secretary Amina Pangandaman said in today's budget deliberation in the Senate that the Department of Health has yet to provide the list of healthcare workers who have not received their COVID-19 allowance or benefits since the beginning of the pandemic. Any comments regarding this matter, Yusek?
Yes, John. With all due respect, we have submitted the list of these healthcare workers last September 6 and last September 13 in compliance to the requirements na hinihingi po sa atin ng Department of Budget and Management para makumpleto at ma-release po ang mga pondo na kailangan ng ating mga healthcare workers. The Department of Health consolidated, prepared and submitted all of these requirements immediately based on our capacity. So last September 6, we have submitted the list of 55,000 healthcare workers for the special risk allowance. And last September 13, we submitted the list of 1,617,660 healthcare workers for the health emergency allowance. So ito pong hinihingi natin na pondo sa Department of Budget and Management. This is for us to be able to provide the benefits for our healthcare workers. For this SRA na naisubmit natin, this is totaling to around 1 billion pesos that we have requested from them. And also for this 1.6 million plus healthcare workers, this is for the health emergency allowance na meron pong halaga na 11.5 billion pesos plus. So ito pong pareho na ito na isumite sa Department of Budget and Management last September 6 and last September 13.
Thank you, Yusek. Para po sa ating sunod na tanong mula kay Gerard Naval ng Malaya. May we ask for the DOH statement on WHO's statement that the end of the COVID-19 pandemic is in sight? Yusek?
Yes, this has got parang quite a steer sa ating mga social media platforms. Marami nagtanong. Marami kasi hindi binasa yung buong artikulo. Ang ginawa ng marami, binasa yung title, tapos akala nila siguro sinasabi na ng WHO, patapos na tayo sa pandemya. Ang sinasabi po ni Dr. Tedros doon sa article na yan ay the end of this pandemic is in sight. Ibig sabihin, nakikita niya na baka dadating na tayo dun sa punto that we can be able to declare, no? Magde-declare ang WHO ng katapusan. Pero ang pinaka-importante sa mga sinabi niya, kaya niya nakikita yan dahil sabi niya, nakikita na niya na nagde-decline na ang number of deaths, nagde-decline ang number of severe and critical across the different countries in the world. Nakita rin niya na pataas na rin ng pataas ang coverage ng bakuna sa bawat bansa sa iba't ibang lugar ng mundo. Kaya niya sinabi that the pandemic, the end of this pandemic might be in sight. Kasi he has seen that the cases and the number of those vulnerable dying ay bumababa. Nakita niya rin na yung tool natin to combat this pandemic, yung coverage, tumataas. Pero ang pinaka-importante dun sa article niya at sa mga sinabi niya, ano ang kailangan natin gawin so that we will really reach that end of this pandemic. Unang-unang sinabi niya dyan is testing. Napaka-importante that we still need to have this COVID-19 surveillance system to include testing of people so that we will still determine kung ilan pa rin ang kaso, are there outbreaks that are happening, and dito sa testing, malalaman natin kung nag-mutate pa ang mga virus na ito para malaman natin kung meron tayong panibagong aksyon na kailangan gawin. Pangalawang sinabi niya, clinical management. Yung clinical management, alam niya at alam natin lahat, mas prepared at mas equipped tayo ngayon compared to the previous times that we had in this pandemic. Kasi ngayon, may mga gamot na tayo, meron na alam na ng mga doktor natin sa bawat ospital kung ano ang gagawin kapag may COVID-19 patient tayo. So kailangan prepared ang healthcare system, prepared ang ating clinical management of our COVID patients if and when na patuloy tayong bumabaybay dito sa pandemya, biglang tataas ang kaso, meron tayong pangsalo at kaya nating gamutin ang mga magkakasakit. Pangatlong sinabi niya na napaka-importante, kailangan pa rin hanggang sa ngayon, ma-reach natin yung vaccination targets natin. Alam natin that the vaccines, one of those that can really keep us going and reach that target na mawala na itong sitwasyon ng COVID-19. So sabi niya, kailangan hindi lang primary series, kailangan may booster dose din ang ating mga kasama, no? And all over the world, this should be part of the targets because this will protect us from the severe forms of the disease. Pang-apat na sinabi niya, kailangan ngayon pa lang na institutionalize na ng ating mga healthcare facilities ang infection prevention and control measures. So kailangan alam na natin on how we manage, no? Ito pong ating mga pasyente, how we protect our routinary work or regular lives. And the last, tulong-tulong, sabi niya, let's manage the infodemic because it has affected the response of each and every country all over the world. Kailangan malabanan natin yung nagpapakalat ng mga maling impormasyon, yung nagpapakalat ng mga unscientific na data laban sa bakuna or di kaya ay laban dito sa mga response na ginagawa natin. So these were the things that were most important dun sa article niya. Aside from him saying that he is optimistic na he is seeing the end of this, but he did not say na tapos na. He said na andito pa yung virus. Kailangan lang bawat tao sa buong mundo matuto na mamuhay kasama ang virus.
Salamat po, Yusek. For the next question, Ms. Kaylin opted to just defer that question. We'll go straight to the question of Dec Villanueva from the Philippine Star. Can we also get an update on the country's monkeypox cases? And can we say that there is no local transmission yet? Yusek?
Yes, Dec. No? So unang-una, I can not be certain to say that there is no local transmission. Bakit? Alam natin na hindi naman natin natetest lahat. Alam natin na hindi lahat ng may simptomas kung sakasakali ay nakakapagpa-test o pumupunta sa kanilang mga doktor para magpakonsulta. So there is no certainty. But what is certain right now? Handa tayo. Handa tayo to detect, handa tayo na gamutin, handa tayo to prevent transmission of this disease. Government is doing all of its efforts para mapigilan natin na kumalat ang sakit na ito dito sa ating bansa. Ngayon, ito pong ating mga kaso ngayon, hanggang sa ngayon, 4 pa lang ang kaso natin. Although, marami pa rin po ang nagpapatest araw-araw sa ating pong laboratorio and wala po tayong nadidetect pa na nagpa-positive uli. Our case number 3 has already ended home isolation last September 8, fully recovered, was certified by a physician. Lahat po ng kanyang 17 close contacts have already finished their quarantine. Walang nagkasimptomas. Lahat po na-discharge from quarantine na rin. Our case number 4 has already been discharged from hospital last September 15. He is continuing isolation dun sa kanilang bahay and isolated siya dun sa kanyang bahay. Titignan natin hanggang the 21st day and has to be certified also by their physician. Pero wala nang additional symptoms pa na itala para dito sa case number 4. Isa na lang ang nagko-continue ng kanyang quarantine dito sa close contacts ng case number 4. Ito yung kanyang kamag-anak na nag-alaga sa kanya. So, nag-start pa lang ng kanyang home quarantine nung na-discharge ang pasyente sa ospital. The other 19 have already finished their quarantine and all of them were asymptomatic.
Thank you, Yusek. For our next series of questions, we will be calling on our media partners to ask live, starting with JC Cosico of TV5. JC?
Hi, ma'am. Ma'am, Okta research said that the NCR's positivity rate increased to 14.5% as of September 14 from 12.7% last week. May we get your thoughts on this? Do you share the same numbers? And can we attribute this to the East outdoor face mask policy? Thank you.
Thank you, JC. No? So unang-una, ang ating positivity rate sa National Capital Region sa ngayon is at 16.4. Pag tinignan natin, comparing this to the previous 2 weeks, makikita natin na tumaas talaga. Makikita rin natin ngayon that among the different regions in the country, ang NCR ay pumasok na uli sa moderate risk case classification. Bagamat ang kanilang hospital utilization is just at less than 40%. No? So for the wards, it's just 39%, and for ICU, it's just 33%. Pero yung kanilang mga kaso ay medyo dumadami ngayon, kaya tumaas yung kanilang ADAR. Ito pong ating National Capital Region, if we try to look at this, disaggregating it, meron po tayong 11 out of the 17 cities and lone municipality in NCR na nasa moderate risk case classification. And meron po tayo na 6 out of the 17 na meron pong pagtaas ng mga ward accommodation or admission sa kanilang mga ospital. Although ang ICU natin sa NCR, we only have Pasig and Muntinlupa na medyo mataas ang kanilang ICU admissions for COVID-19. So nevertheless, pag tinignan natin sa kabuuan, ang NCR is at moderate risk case classification but still at low risk for their utilization of their hospitals. So having said that, alam natin na mas importante sa atin ngayon yung severe and critical at saka yung ating mga healthcare system capacity. So therefore, they are at low risk right now. And ang masasabi natin nga, hindi natin pwedeng i-attribute na itong pagtaas ng mga kasong ito dito sa pagtatanggal ng mask outdoors. Because as I've said, it would take us around 1 to 2 weeks for us to be able to analyze the effect of this easing of masking or optional masking outdoors. What we can say, tumaas ang mobility mula na nag-umpisa yung face-to-face classes. So tinitignan natin yung link at relasyon nito dito sa pagtaas kasi hindi naman natin nakikita yung ganitong pagtaas sa ibang region.
Thank you, Yusek, and thank you, JC. Our next question will come from Caroline Bongkin of CNN Philippines.
Ma'am, you've mentioned earlier na ang isa sa uh, panukala nyo sa Congress is yung Magna Carta para po ma-revise at maging pantay na yung private and public hospital nurses. Kasi sinabi na po ng private hospitals na hindi nila kayang ponduhan yung additional salary and benefits kung hindi sila magtataas ng hospital fees. Doon po ba sa Magna Carta, sino po ang magpopondo nung maidadagdag na sweldo or benepisyo? Is it the national government po for the private hospital workers?
Yes, no? So unang-una, ito ay sa subject natin sa dialogue at saka konsultasyon. Itong Magna Carta natin ngayon for the public health workers is being subsidized by the national government. And rightfully, because these are government employees. Now, based on our laws and also the practice and the system, pagka private sector, ang nagbabayad sa kanila private, no, for their salaries and other benefits. So kailangan lang mapag-usapan at through consultation, makita natin the capacity of our private hospitals to pay for this additional compensation. Kailangan maintindihan din natin yung sources of funds natin. One of the things that the government has fully subsidized would be our indigents. And through this, meron tayong PhilHealth coverage. Now, aside from indigents, may benefits pa rin ang PhilHealth for the other diseases, even for those non-indigents. So with this, when a patient goes to the hospital, we cover it with the PhilHealth subsidy. And with this PhilHealth subsidy, nakapasok po dyan yung bayad natin at kasama na dyan yung operational expenses ng ating mga ospital. So hopefully, this PhilHealth reimbursements, as we improve our benefit development, will be able to cover this additional compensation that our private healthcare workers would need in the coming years. So katulad ng sabi ko, nothing is final. We are still proposing, consultations will be done, dialogue will be done so that we may see how we, the national government, can fund for this kind of laws that are being proposed.
Salamat po sa paglilinaw, Yusek, at sa tanong, Caroline. Ang ating sunod po na tanong will come from Red Mendoza of the Manila Times.
Yes po, Yusek, good morning po. I have two related but separate questions. Ngayon po na operational na po yung Cancer Assistance Fund. Paki-elaborate lang po yung magiging implementation plan nito, yung mechanics, the centers, ano po yung mga hospital na nabigyan ng budget, ano po yung mga diagnostic tests or treatments na kasama po doon sa CAF. And also, meron po kami na-receive na may mga cancer patients daw po na na-turn down dahil daw po yung mga medicines nila wala daw po sa Philippine National Formulary. Like for example, trastuzumab na wala daw po sa PNF. So ano po yung mga medicines na hindi po included sa Philippine National Formulary pero pwede po siyang ma-cover sa Cancer Assistance Fund? Thank you.
Yes, thank you. No? So unang-una rin, itong Cancer Assistance Fund, uumpisahan pa lang natin ipatupad. Dahil kakalabas lang at kakapirma nitong ating joint memo circular between DOH and the DBM. The total amount of this cancer assistance fund is 529 million. Ito, valid siya for 2 years, 2022 and 2023. So hindi po kailangan mag-alala ng ating mga pasyente na may cancer na gustong maka-access nitong pondong to dahil hanggang sa 1 taon po itong pondo natin ay maaari pa rin gamitin. Ang pondong ito ay ibababa natin sa iba't ibang mga cancer hubs natin, sa iba't ibang regions natin. So we have a list of these cancer care centers kung saan doon ibababa at doon po proseso. Just like the assets that we have, may pondo sila, maaari pong i-access through this funds dito sa mga ospital natin. Ngayon, ano ba yung inclusions? Itong Cancer Assistance Fund, primarily, base sa batas at pag-uusap natin with our experts from Cancer Council at saka sa ibang mga stakeholders, ito ay pang-suporta dun sa mga pasyenteng may cancer. So this will include cancer diagnostics. This will include other medications that will not be part of the commodities that we have doon po sa ating mga binibigay na libre rin sa ating cancer patients. At iba pa, nakakailanganin ng ating mga cancer patients. Hindi lang po cancer patients ang included dito, pati po yung mga nagkaroon ng remission, tapos kailangan nilang magpa-test regularly, they are part of this fund. So, simple lang po ang magiging proseso natin. It's just like the medical assistance in our different hospitals where they can access that as long as the hospital is part of the cancer care network na meron tayo. Maglalabas po ang kagawaran ng kalusugan ng listahan ng mga ospital na maaring ma-access itong Cancer Assistance Fund at kung paano ang gagawin nila at saka ano yung mga pwedeng pumasok at maihingi nila ng tulong dito sa ating cancer assistance.
Thank you, Yusek, for those details and Red for the question. Ang sunod po nating tanong ay manggagaling mula kay Rafael Bosano ng ABS-CBN News. Rafi?
Hi, ma'am. Bago pa man po sabihin ni Dr. Tedros that the pandemic is in sight, sinabi rin ng WHO that the end of the emergency phase of COVID may happen at different times in different countries. So dito po sa Pilipinas, ilang buwan na rin po natin nakita mababa yung metrics. So is the DOH and the IATF planning on a timeline to observe para po masabi natin na to make the decision na yung emergency phase po ng pandemic dito sa Pilipinas ay tapos na?
Yes, Rafi, kasama yan doon sa mga pinag-uusapan. Katulad nung naibigay namin sa inyong feedback noon after the IATF, nandun na yung discussions on the lifting of state of calamity, the recommendations, and also yung ating timelines kung kailan pwede nating pag-aralan naman ang pag-ease ng mask mandate indoors. And we said there should be conditions. So the emergency phase of this pandemic would always give you that notion na kapag tumataas ang kaso, medyo na-overwhelm tayo, nag-emergency phase. And we saw that in our previous situations here in the country. Nung nag-Delta situation tayo, nung nag-Omicron tayo nung first 3 months of this year. Pero nakikita natin, katulad ng sinasabi mo, mukhang nagsa-stabilize na. No? We have 2 policies in the country for this public health emergency. We have proclamation number 922, which is the proclamation for the public health emergency status of the Philippines. This public health emergency proclamation was born out of that RA 11332, yung notifiable diseases na RA, na kapag kami ganitong nangyayari sa isang bansa, kailangan ang Secretary of Health recommends to the President that there should be this declaration of a public health emergency. State of calamity, likewise, also linked to this, was also declared because of the different logistics and resource requirements that the country needs in this time of public health emergency. So having said that, kapag nakita natin na continuously stable po yung ating mga kaso, nakita natin through the months less and less deaths, less and less severe and critical, nakita natin, pinaka-importante, mataas na yung ating pagbabakuna for the first booster shot. Marami nang nakapag-primary series na itaas natin yung wall of immunity natin. And then we can readily and confidently say na and discuss already na dadating na tayo dun sa punto na pakatapos matapos na nga rin talaga ang emergency phase dito sa ating bansa and we can start discussing further opening and lessening of restrictions in the country.
Thank you so much, Yusek, for those clarifications. Our next question will now come from Madeline Villar of Net25 Maths.
Hi, good morning, Yusek. Tatanong ko lang po, kung kayo po sa DOH, kagaya rin po ba ng WHO, sa tingin po ba ninyo dito po sa Pilipinas naman, talaga bang papunta na tayo doon sa katapusan ng pandemic with the low coverage ng booster and yung cases po natin bumababa na, pero may mga variants and sub-variants pa rin po yung lumulutang ngayon at nagkakaroon tayo.
Thank you, ma'am. So, unang-una, we agree with Dr. Tedros. Globally, pag tinignan natin, base sa mga statistics ngayon, base sa coverage ng immunization all over the world, mukhang we are seeing the light at the end of this tunnel. Pero dito sa Pilipinas, pag tinignan natin, ako personally, no, and even the department feels na we are seeing na mukhang matatapos na nga, pero kailangan handa tayo. Kasi alam natin, kahit matapos itong pandemyang to, the virus is here to stay. That's why WHO recommended these 6 measures na dapat magawa natin yan so that if in any case, dumating tayo sa punto na matatapos na itong ang sinasabing pandemya na ito, our country is prepared because the virus will stay. Expectedly, it will still cause outbreaks every now and then. Expectedly, it will still cause 1 to 2 deaths or some deaths every now and then. Because di naman mawawala yung COVID-19 na andyan yan. What we need to do, strengthen our system, strengthen the immunity of the population, make our facilities ready so that pag dumating yung punto na yan, lahat po tayo prepared, wala tayong pangangamba, tayo po ay protektado.
Thank you so much, Yusek and Mats, for the question. Our next question is from JP Nunez of UNTV.
Yusek, related din po dun sa mga question. Yun lang pong term na endemic stage, papalapit po ba dun? At kapag dumating po ba dun sa endemic stage ng COVID-19, ay officially po ba magkakaroon din ng announcement doon ng DOH po?
Definitely, definitely. The shift from a pandemic to an endemic state should be announced and pronounced also by the Department of Health recommending to the President. Ngayon po, yung public health emergency of international concern, the pandemic has been pronounced by the WHO based on certain parameters. Kapag nag-usap tayo epidemiologically, ang definition ng endemicity or yung endemic stage, kailangan ang mga kaso acceptable na sa populasyon. Kailangan yung mga numero ng mga namamatay is stable enough that it be acceptable also to the population. Kailangan mataas ang immunity ng population for us to reach that stage of endemicity. So we can only declare here in the country that we are already at that stage of endemicity when we fulfill all of these conditions. So ngayon, nakikita natin, stable na yung mga kaso. Nakikita natin, hindi naman ganun kataas sa mga namamatay, pero may namamatay pa rin. So nakikita natin, mababa pa ang booster shots natin. So kailangan pagtrabahuhan natin yung ating coverage ng bakuna, maipataas, tumaas ang wall of immunity, and therefore, pag dumating tayo sa point na yun, baka sakali, no, kung all over the world also, yun na rin ang direksyon at nangyayari, baka we can see also yung ating pag-declare din ng state of endemicity. But until we can fulfill all of these conditions that I have said, we cannot declare that endemic stage in the country.
Salamat po, Yusek at JP para sa tanong. Our next question comes from Cedric Castillo of GMA News.
Hi, ma'am. Good morning po. Ma'am, on another matter po, we're doing a story on medical marijuana, ma'am. Doon sa pending bill sa Senate po, may I know kung ano po ang take ng DOH dito? At saka ano po ba yung current policy natin if at all sa use of medical marijuana? Thank you, ma'am.
Dati pa naman, through the Food and Drug Administration, meron na tayo yung tinatawag na Compassionate Special Permit. This is the special use of medical marijuana for those cases that had been allowed para gumamit nito. Ang kailangan lang natin kasi kapag mga ganitong drug components, ay nare-regulate natin siya na maayos because it is subject also to abuse. Kaya ngayon, ang Food and Drug Administration, nakikipagtrabaho siya sa iba't ibang ahensya, pati na rin sa ating mga legislature, dito sa mga pinopropose para mas maisaayos natin ang regulasyon, mas magamit ng mga medically needing individuals. So ngayon, meron tayong compassionate special permit. Those who are going to use this for specific conditions like cancer or extreme pain, kumukuha po sila nitong permit na ito sa FDA, yung doktor nila, and the doctors are accountable for that use of the patient so that we can regulate. So tayo po, open tayo sa ganito as long as it can provide that medical relief to our patients as long as it is properly regulated.
Thank you so much, Yusek and Cedric, for the question. Our last two questions will come first from JC Cosico of TV5. JC?
Hi, ma'am. BPO firms were allowed to keep work from home option, but with the current infections we have, does the DOH agree with this? Dapat po bang ituloy itong work from home arrangements, ma'am? Thank you.
Yes, JC, we agree to this. Marami na pong pag-aaral all over the world na lumabas na marami ang nagbenepisyo sa mga work from home arrangements. Hindi lamang po benepisyo ng ating mga businesses or benepisyo ng ating mga employers, pero benepisyo individually. Lumalabas po sa mga pag-aaral ngayon na itong work from home arrangements have helped our individuals who do this na magkaroon ng mas balance mentally, physically, and they have more parang ano ba yun, drive to work. No? So ito pong work from home will help us not just during this COVID-19 situation, but also for the other diseases as well. Because we know that more interaction, there is more transmission of diseases. So kung kaya naman pong magtrabaho sa bahay, ang ating pong mga employees at pinapayagan naman. At ito naman po ay makakapag-deliver ng the same output as what they have when they are physically present. The DOH is all for this because this will also prevent further transmission of COVID-19 and not just COVID-19 but other diseases.
Thank you, Yusek and JC. And for our last question for this morning from Caroline Bonkin of CNN Philippines.
Ma'am, I'd like to ask lang po sana kung may nailabas na guidelines yung DOH regarding the optional wearing of mask outdoors. And last time you said po na may parameters tayo para ma-suggest nyo na ibalik ito. Pwede po bang malaman specifically yung figures, gano'ng karaming positivity rate and healthcare use, if ever po, at what point yun na i-recommend na ibalik yung mandatory wearing outdoors?
Yes, Carolino. So yung policy natin to adopt the EO number 3 at saka yung mga pinag-usapan sa IATF is already routing for signature. So ilalabas na natin maybe early next week. Ang atin pong thresholds, katulad ng sabi ko, we align it with our current policies and systems in place. Kung saan may alert level system tayo, kapag dating natin ng alert level 3 kasi nakikita na natin, pumapalo na yung mga tumataas ang admission sa mga ospital. So we are adapting this alert level system where pagdating natin ng alert level 3 and we see that there is continuous increase in cases, there is increasing admission in our hospitals based on the threshold set forth in alert level 3. And then we will be recommending to IATF to recommend to the President that we then again use our mask and mandate it outdoors.
Thank you so much, Yusek. At last na pahabol question na lang po. Sige, from Caroline Bonkin.
Ma'am, para lang po, can you refresh our memory lang po, ma'am, kung ano po yung parameters para sa alert level 3? Thank you.
Yes, ang alert level 3 natin would include the alert level system. We have our healthcare utilization at saka yung number of cases. So kapag yung average daily attack rate natin, nagkaroon ka na ng high to critical, and also your healthcare utilization would also be at that moderate to high risk already. And then you get to have alert level 3.
Thank you so much. And that's all the time we have for our questions. Yusek, ano po ang ating mga closing remarks and messages po?
Yes, gusto ko lang magpasalamat sa lahat ng ating mga media partners sa patuloy na pagsuporta at pagtulong sa pagpapakalap ng tamang informasyon. Katulad po ng sinabi ni Dr. Tedros ng WHO na maari na nakikita natin na yung dulo nitong sitwasyon natin ngayon for COVID-19 ay maaring nakikita na natin. Pero hindi tayo dapat maging pabaya, hindi tayo dapat maging complacent. Dapat maging mas vigilant tayo, dapat maging mas mapagmatyag, dapat laging informed and aware tayo. Sundin po natin kung ano po yung mga nararapat nating gawin para tayo ay makarating dun sa lahat na gusto natin na matapos na ang sitwasyon na ito. So please, have yourselves vaccinated. Lalong-lalo na, yung natin pong first booster shots ay napaka-importante para itaas na ho natin uli ang wall of immunity sa ating bansa. Lagi niyong tatandaan, ang sakit na COVID-19, ang risk nito is shared. Ibig sabihin, kahit na tayo ay gumagawa ng mga tamang pamamaraan para maproteksyonan ang ating sarili, kung ang ating kapitbahay ay hindi gumagawa ng ganitong klaseng proteksyon, maaari pa rin magkasakit ang inyong komunidad. Katulad na rin ng bakuna, it's a shared benefit for everybody. I get vaccinated but you will not get vaccinated. Hindi po nabubuo yung immunity na kailangan natin sa populasyon. Ang ibig ko pong sabihin, magtulong-tulong tayong lahat. Each and every Filipino should do their part for us to reach ito pong sinasabi na malapit na matapos na itong pandemya kung tayo lahat ay magtutulong-tulong para maipataas ang bakunahan, para maproteksyonan ang bawat sarili natin, pati na rin po yung ating pamilya. Maraming salamat po. We'll see all of you on Tuesday.
Thank you so much, Yusek, at salamat po sa ating media partners. Magandang umaga. Have a happy weekend to everyone.